Hi, my name is Eliot Taylor, and I go to Menor High School, and I'm going to be a junior next year. I'm in the pharmacy internship program, and my title of my project is The Retrospective Review of the Renal Dose Monitoring Program. Since 2005, pharmacists have had the ability to assess and modify physician orders based upon a patient's renal function or kidney function. The list of adjustments are approved by Hillcrest Pharmacy and Therapeutics P&T Committee and Medical Executive Committee. Doses can be increased or decreased when warranted. The primary objective of this project was to determine if pharmacists are assessing renal function at time 0 and time 48. The secondary objectives of the project were to see if the doses were appropriate at time 0 and time 48, which was the time of prescribing and 48 hours after prescription, and to see if the doses were appropriate on weekdays as opposed to weekends. For time 0, or the time of prescription, pharmacists assessed doses 72% of the time, and 89% of the time those doses were correct. They did not assess 28% of the time, and 82 of those doses that were not assessed were correct. At time 48, or 48 hours after prescribing the medication, 17% of pharmacists assessed the drugs, and 100% of those medications were correct. 83% of the pharmacists did not assess the medications, and 93% of those were correct. A clinical pharmacist is a pharmacist that rounds with the physician, counsels patients, and monitors the drugs for a specific patient if they're in need. That is why at time 0, only 18 clinical pharmacists were assessing doses, while at time 48, 31 clinical pharmacists were assessing doses. This can account for why at time 48, most of the assessment was done by a clinical pharmacist and not a regular staff pharmacist. At the weekday, at time 0, 73% of the doses were assessed by a pharmacist, and 99% of those were correct. 27% was not assessed by a pharmacist, and 79% was correct. The weekend was almost the exact same. The greatest impact for the appropriate dosing is at time 0. So if we fix the doses at time 0 and make sure they're appropriate, at time 48 we should have no problems. 9 out of the 18 doses were wrong at time 0. This is an example of how 9 doses would have been correct at time 0 and time 48 if the pharmacist had got it correct from the beginning. Pharmacist assessment is consistent throughout the week despite having less pharmacy staff on the weekend. I recommend that this is presented to the Hillcrest Hospital's P&T Committee, and we put a plan in place to re-educate pharmacists on the importance of renal dose monitoring. I would like to thank the Cleveland Clinic, Hillcrest Pharmacy Department, Molly Loney, Nick Link, Mike Jacobez, and Jeff Weil for all their help and support. Thank you.